I'm going to be presenting on this report, this qualitative exploratory study that was done by me as principal investigator and a couple of other colleagues at the Urban Institute. And this focused on really understanding the perceptions of incarcerated people around their ability to receive care, reproductive health care, while incarcerated in a San Diego women's jail. And so, what I wanted to start out with is just some brief framing about jails and reproductive health care. I assume a lot of you know this information already, so this might be repetitive, but I think it gives us all a solid foundation and clarifies some assumptions that we all might have about this topic. So, next slide, please. So stating the obvious, I like to usually use some slides to this effect going into conversations because I think oftentimes when we talk about reproductive health care or healthcare delivery in jail settings, it comes up naturally that there are people that maybe shouldn't be in these settings that are better served in the community. But again, I think it's really important to acknowledge that jails don't control who come into their custody, but they are responsible for the care of those people while they are in their custody. And again, that's stating the obvious, but I think that's an important assumption that we should all acknowledge going into this conversation, because I think it is, again, really easy to dive into thinking about alternatives. But as I understand it, you all are talking about care during incarceration and upon reentry when people are already involved in the system. So next slide. So in terms of who's coming into the jail, I focus this again on jail and then women in jail specifically. And so this data is the most recent data that we have from 2024. This is national statistics data from the Bureau of Justice Statistics. So they do all the statistics across the country on people who are incarcerated and involved in the criminal legal system, and they issue reports every year. They're a really fantastic resource if you don't use them or cite them already. And so what we know from the most recent report is that in 2024, there were about 190,000 women that were incarcerated in the United States. And nearly half, 44% of them, were held in local jails. And so really a lot of women are coming into the system, they're going through, and they're predominantly in jails more than state prisons. And then, as you all know, people are cycling in and out of jail. So over 1 million women were admitted to jail and then released at some point. And importantly, and what I find really interesting is state prisons hold a lot more people than jails, but there are more women in jails than in state prisons. And so that's really why it's important to focus on what you all are focusing on. And I know CDCR is in the room too, and both focusing on state prisons and county jails. And then lastly, women's incarceration has grown 2 times the rate of men's over the past several decades. And so this really is a growing population. I think a couple decades ago, it might have been easy to say, well, they're a very small portion of our population, just a few people are coming in. We don't need to adapt our practices, but they are one of the fastest growing populations that are incarcerated. And so if things continue that way, they will continue to grow, and this would be a more urgent need for correctional administrators and staff, and you all working in the community as well. Next slide. So in terms of the reproductive health profiles that people are coming in with, and I think many of you probably already know this, but I think it's important to acknowledge that women who are coming into the jail, or also generally in prison, women who are being incarcerated, are coming in with both significant and specific reproductive health care needs. So what does that mean? Compared to the general population, women in jail are more likely to have STIs. They're more likely to contract HIV, have viral hepatitis. They are more likely to have cervical and breast cancer. And they also are more likely to have irregular menstrual cycles. And so, again, we can't control who's coming into the jail. You all are working with this population, but they're coming in with pretty complex reproductive health needs to begin with. And that, coupled with many folks not having access to health insurance before coming into the jail, makes for a really complex medical situation and profile that someone is coming in with. And so I think it's important to acknowledge that. And in addition, most women who are in jail and also in prison are in their peak reproductive years. I think you can argue what these peak reproductive years exactly mean, but some scholars specifically focused on jails and prisons really define that as for the adult criminal legal system between the years of 18 years old to 44 years old. And most people are within that window. Next slide. So stating the obvious again, delivering reproductive health care in a jail setting and in corrections settings writ large is very challenging for many reasons. Sometimes when I've been in the room with folks, there are sometimes assumptions that, it's easy to do this type of thing. Why aren't we doing something differently? And jails and correctional facilities are really complex settings. They're dynamic settings. Risk is changing very frequently. There are a lot of different priorities that folks are balancing. And the same in the community when folks are reentering and community supports are providing services. There's a lot of balancing of priorities too. Next slide. And so I want to talk through a little bit about what we know from research. This is not specific to the study that I did, but more generally what we know about reproductive health care in jails. We know generally that folks report access barriers. So for instance, a lack of services, maybe they're receiving lower quality care than they would like to, or that they felt that they were receiving in the community as a comparison point. There are a lot of logistical hoops. So for instance, if you want to receive care, but it's not urgent, you maybe have to send a kite message. You maybe have to fill out a medical slip that's going to go into a processing area. There are a lot of staffing movements generally within the facility. And so that request is getting put into the general operations of the jail or corrections facility. Again, and another thing that the research has at least highlighted, and I'm not saying this is what's going on locally to you all, but generally across the country, across the United States, is that medical care in jails is often reactive rather than proactive. So someone presents an issue, they're responding to that issue. And preventative care for many reasons can be really challenging in a jail setting, especially because of budgets, staffing constraints, all of these other reasons attached to that I'm happy to dive into later. And then I'll just quickly go through maybe one more of this, and this is relevant to this group, is that prenatal care, pregnancy, and postpartum care are often perceived as limited by people who are incarcerated as well as providers within the jail and jail staff. And there are some national standards around what prenatal care, pregnancy care, and postpartum care should look like in a jail and a prison setting that really guides how facilities are operating. But often, even if those guidelines are being met, there's a disparity in how patients feel like their needs are being met. And so there's typically a gap there. Next slide. Stating the elephant in the room, corrections is facing an ongoing national staffing crisis. Jails simply don't have enough staff. Prisons simply don't have enough staff. And so I'm recognizing that a lot of people on the call may be community service providers who are perhaps going into a jail or working directly with incarcerated people. And, jails and prisons are really strapped for staff. I know, at least for me as a researcher coming in, typically, when I come in, I need to be escorted. I'm going through multiple security processes. That takes a lot of staff time. And, when you don't have enough staff to cover basic shifts, research or services might not be as much of a priority when you're really uplifting basic operations of the facility. And so I think it's important just to lay that out too, because I think that is this undercurrent of a lot of challenges in delivering reproductive health care in these correctional settings. Next slide. And focusing on this topic still matters. Most people who are incarcerated are coming back into the community, and they can either come back from jail sicker, which usually is what happens. Research has demonstrated that, or they can come back from jail healthier and leading to better outcomes for parents, for mothers, for reproductive health care, general mental health can really reduce the likelihood that people are coming back into jail and circling through the system. So next slide, I'm now going to talk about, oh, just one more thing. So you all may be familiar with Assembly Bill 732. If you are, please give me a nod. But this was signed into law in September 2020. And really the goal in response to recognizing the challenges in delivering reproductive health care is that the state of California wanted to create some standards of what to be expected for jails and prisons to provide to people in terms of reproductive health care. And it's a very comprehensive piece of legislation. There are a lot of different moving parts, but largely it focuses on ensuring preventative care, menstruation support, pregnancy and parenthood support, contraceptives, and abortion access. And so sites, prisons and jails all over the state of California have been implementing responses to this legislation. There are some places, for instance, like San Diego County, that formed a working group that worked on implementing and being responsive to the needs of this legislation. And then there were some places who were already doing most of this, and they just had to tweak a couple of things to be more in compliance with this legislation. So I'm going to talk through this study. And next slide, please. But this is a qualitative study. It's an exploratory study. And I think that's important to acknowledge because this means that we are not saying because of Assembly Bill XYZ, this thing happened. This is not causal. But reproductive health care is typically pretty understudied in correctional settings. And this was an opportunity that San Diego County provided to us to be able to study what was going on and really get under the hood of what was happening in their facility as perceived by incarcerated people. And so this was a really unique opportunity to be able to interview folks and learn from their experiences. And so we interviewed 34 people at the correctional facility. We had, I think, over 70 people that were interested, but this was the amount of people that we were able to reach with their staffing levels and constraints around time. Of course, we can't just be there for an infinite amount of time. And then we also had folks who participated in an interview fill out what we call this post-interview demographic survey, just to gain a bit more quantitative information about their experiences and their history. Next slide. And so what we covered in the interview was all of these aspects of the legislation and really asking people, how did you feel about menstruation support that you're provided? How do you feel about the postpartum care that you've received? How was the newborn care and placement process for people who had given birth? What does pregnancy testing look like? And so we really were trying to ask people comprehensively about all these different aspects of reproductive health care. Next slide. In terms of who participated in the study, 84% of the sample were of childbearing age, again defined between 18 to 44 years old. About half were white, 41% identified as Latinx or Hispanic, and 21% identified as Black or African American. And a little over half self-identified as heterosexual or straight, and a little over a third identified as bisexual. When you can see in the report, we asked about a lot more information than this, but I didn't want to go too much into all of that. But I think important to note is that most people that we interviewed lived in a rental or a owned apartment or house, but 13% experienced homelessness immediately prior to incarceration. And half made less than $20,000 annually across both formal and informal incomes. So again, this gives you a sense of who is coming into the jail. What I'm not saying is that this is representative of the whole jail or of jails across the United States, but this was at least representative of the types of people that we interviewed. Next slide. And something that I thought was really interesting, and I'm not sure if you all are collecting this data locally. Most places don't know how many people are parents coming into the jail or have children. But 69% of study participants had children and indicated that they had them. And you can see the distribution of how many children people had. And so most people had more than one child that they were responsible for. Next slide. And then I thought that this was perhaps one of the most interesting aspects or discoveries or findings of the project is that we found, so we asked people how many times they had been pregnant. And across our sample, nearly half had been pregnant 4 or more times. And so people are coming in with long pregnancy histories compounded with complex reproductive health histories such as irregular periods, potentially cervical or breast cancer, history of STIs, etc. And so this was really interesting to see as a finding of how significant people's pregnancy histories were coming into the jail. And about a third of our sample were pregnant while they were at the jail, and 20% had given birth while they were at the jail. So we were able to learn from their perspectives when we interviewed those people. Next slide. So I'm now going to go into the most interesting part, which is our study findings. You can go to the next slide, Dr. King. Thank you. And so really what we found, and I'm curious to see if this is something that you all resonate with locally, because this is specific to San Diego County and their women's jail. But we really found overwhelmingly that folks were telling us this, they were describing this cycle where they were coming in with high needs, they were facing barriers in requesting care. So for instance, submitting that medical note, submitting a kite, requesting, saying, I need XYZ, I'm having this problem. So they were coming in with high needs, they were having issues requesting care, accessing care. There were lengthy delays in actually being able to receive care, likely because of a lot of capacity issues that the jail was facing with their health contractor at the time. But then when folks received care, they felt they reported that the care that they received was not the type of care that they wanted. And so that led to this cycle that's described on the screen of this low patient satisfaction with the care provided, a hesitancy to request further care, knowing that, there might be delays, there might be challenges in requesting it, they might not get the care they exactly want, and this worsening of medical issues. And so folks, really every single person we interviewed, all 34 people, described this cycle very clearly as a challenge that they were experiencing. For the next slide, we also asked folks about some reflections on requesting and accessing care. So again, folks talked about these, what they described as lengthy delays between requesting services and being able to receive services. Sometimes that was up to 6 or 7 months that someone is waiting, for instance, for a consultation with an OBGYN. Folks also described a challenge as feeling dismissed by medical staff. So maybe there's an issue that they believe they have, but perhaps the nurse practitioner or the doctor on site does not believe that it's an issue. And there's a discrepancy in perception of what is a medical issue according to the patient versus the staff, what they feel is an issue. And then something else that came up a lot was really folks feeling the need to exaggerate medical requests as an emergency in order to receive care. So maybe they submitted a couple of requests, they weren't responded to in what they felt was a timely fashion, and so they considered to exaggerate what they were feeling in order to get care. And I think, at least from the jail perspective, something that was really challenging about this is then they were sorting because people were submitting multiple requests. Then they were sorting through this very high volume of requests and not being able to tell when it was someone was requesting, 20 times the same thing, or if it was a worsening condition. And so it really was clogging up the system in many ways for the jail to be able to effectively respond to people's needs. And then, of course, people on the patient side feeling frustrated because they felt like their needs weren't being met. I'll go to the next slide now. Another area were these reflections on delivery of care. And so some folks raised to us that they felt that the medical staff that were providing care were not qualified in the ways that they felt that they should be. Something that is very common in a jail or a correction setting is that it's an enclosed space. There's not a lot of privacy. And so some folks said that it was uncomfortable to have someone talk about what they felt was private medical information in a jail common space. So for instance, and I think this is in the report, one person said that, they got tested for an STI, they found out they had the STI, and they felt that it was said too loud around all of their peers by the nurse practitioner delivering the results. And so they felt embarrassed by that news, and then that their personal information was out there for other people. I'm going to go to the next slide just in interest of time. Some other reflections on the delivery of care is that half of study participants shared that they did not feel comfortable or safe receiving services. And then nearly a third of study participants indicated that they experienced bias or pressure from jail staff around certain decisions. So for instance, whether they might receive an abortion as opposed to proceeding with a pregnancy and delivery, in terms of what type of family they might choose for their newborn placement. And then folks also indicated pressure around feeling the need to be tested for pregnancy at intake. But I think it's important to note that this is required as part of the jail's processes. So there's less room for, I think, autonomy there. Next slide. And next slide. Thank you, Dr. King. Okay. These are some specific findings on some specific areas. So menstruation support, people were overwhelmingly very positive and said that every single person indicated that they were receiving tampons and pads that are available and free. There were some reflections in terms of like the quality of those items and having different options available. But this was overwhelmingly a very positive finding that at least was revealed in the San Diego County Women's Jail. Next slide. And in terms of contraceptive support, people indicated that they were receiving contraceptive support of different types. However, most people who were receiving contraceptive support was in response to a specific issue, such as an irregular period, rather than an interest in preventing pregnancy. So that was something that was brought up as a nuance in the contraceptive care. But in the case that someone needed it for a medical issue, it was provided, and we heard very positively about that. Next slide. And then in terms of the pregnancy and postpartum care, this was really an area where I think San Diego could have some room for improvement and was struggling on this. Something that folks mentioned is that successfully they were getting their ultrasound and initial visit to the OBGYN within 2 weeks of booking, which was great. They felt like they were getting that first follow-up and appointment. However, in terms of accommodations or care later on in their pregnancy, that's what they felt were lacking. So for instance, folks noted that if they were pregnant, they got extra food, but that extra food was maybe a packet of peanut butter and didn't feel particularly nutritious or sufficient for what they felt were their food needs during pregnancy. Or for instance, there wasn't really specialized clothing that you could wear while pregnant, so people felt very uncomfortable in their jail clothes and uniform that they were wearing. And there was limited pregnancy counseling. However, the people said that their experiences with the pregnancy counseling when they were able to get it was very, very positive. And so I think that's something worth uplifting and something that folks really appreciated being able to have was someone that is in their court, someone who is helping them navigate this pregnancy process and helping to think about newborn placement and family transition and really just supporting them throughout their pregnancy. Next slide. And I talked about this, so I'm just going to go to the next one, if you could, Dr. King. And then the next slide from here, sorry. So some recommendations for what to do with all of this information. So I think what's really important is research sometimes throws a lot at you, and it's like, okay, well, what does this actually mean, and what changes am I going to make? And so I wanted to pull together a list of different changes that either San Diego County has actively made, or I have seen other places, either in California or across other states, at the jail or prison level made. So every single one bulleted out, there is some practitioner, some jail or prison who has successfully done this. And so one of those categories of recommendations is improving communication and education for incarcerated people. So is there a way, and you all may already be doing this, but is there a one pager you all could provide on what types of services are available to folks while they're in the jail? Informational materials or a brochure or even a class on what's common, what to know about reproductive health care. We got so many questions for people who volunteered to be part of the interview, knowing it was about reproductive health care, and then asked us, can you define reproductive health care and what is normal? So when we asked, do you have an irregular period? Their answer was, well, what is a regular period? And so the ability to increase that education can go a really long way. And that's what at least we found in the study. And specifically, San Diego County is partnering with their local Planned Parenthood chapter and delivers reproductive health care classes and parenting classes to folks on the inside. Something else I want to uplift is creating posters explaining the health appointment request processes. I think one place that I worked with, which is the Department of Corrections in Delaware, specifically included and created these posters that explains their grievance process, their maintenance request process, all these types of things. So people have access to that information and understand what happens when I submit a request, how long to expect to hear back, and really appropriately sets expectations around that. Because someone might say, you know, I didn't hear back for 2 weeks, and the jail is saying, that's great. 2 weeks is really good for us to be able to get back to you, but that person might feel dissatisfied if they're expecting something different. Next slide. In terms of another area is really increasing preventive care and testing when possible. So I'm not sure if you all are doing this, but implementing universal STD and STI testing at booking, implementing universal pregnancy testing. Many times folks are coming in, they might not know they're pregnant, or they might not know they have an STD or an STI. And so access to that information can really help them and understand what's going on with their bodies and then seek appropriate medical care. And then another thing that I've seen places do is create some way in their health record system to automatically schedule someone for an appointment with the OBGYN if they've been in the jail for over a year. So that's just automatically scheduled rather than having to go in manually and do that. Next slide. And I'm almost done. Allowing choice when possible. So if possible, providing different types of menstrual supplies, perhaps giving different types of snacks and clothing for pregnant people. And then this one is, I recognize, challenging, but something that I've seen places do is allowing incarcerated people to select the gender of their medical provider. So there might be 2 nurses that are on call. One is a male, one is a female. They might say, I prefer the female nurse. Can I be seen by them for this? For a blood test, for instance, or something. So that is something that, of course, depends on the facility and their ability, but something that I have seen places do. And then I believe this might be my last slide coming up. Identifying roadblocks. And it sounds like you all are doing this already in terms of reviewing your data, seeing how many people are coming in pregnant, seeing how many people are coming out of the jail pregnant. But for instance, can you look at your data and see between the amount of time that someone requested an appointment and when they got an appointment. How long are people waiting? Are people waiting longer for certain types of appointments? And really talking with your health and custody staff to understand any challenges that they're experiencing and strategies for success. These are the folks that are on the ground that can tell you what is going on in the facility and can give their personal lived experience about what is happening and what are the barriers they are facing. And then lastly, of course, speaking with incarcerated people to understand their feedback. I've seen places that have what they call like a warden circle. They have an anonymous note tip box where you can put something, but something to be able to collect some feedback from folks about their experiences.